Hello and welcome to the February podcast. What we've decided to do for PPM and our podcast, we're going to take each one of the steps of the CPR, different items that we use, how we do it, and we're going to break it down step by step through each of the procedures and kind of explain the history or why we're doing what we're doing, because virtually everything you do in CPR, there's actually a logical reason why you do it. So the very first thing I decided to start with was some of the problems we're having with some of our monitors is with the bag valve mask. So I decided, okay, let's go back to the beginning and let's talk about bag valve mask. Now, for those who have been around for a while, myself included, we used to call the thing a AMBU bag. And you say to a person, get an AMBU bag for me, or grab that AMBU bag, bring it over here. Never really thought, I just figured that was the name of the bag. Didn't really realize that there was actually some history to it. So in doing my homework, I found out that the AMBU bag was actually developed in 1953 by Dr. Hess and the doctor and an anesthesiology doctor, Dr. Rubin. And they had both worked on a suction pump to be used for patients, and then they turned their skills, I guess, to making an AMBU bag. And AMBU actually stands for Artificial Manual Breathing Unit, AMBU. So who would have thought that the term AMBU actually meant or actually had meaning for each one of the little letters? Okay, so kind of neat. And it actually hit the street in 1956. So if it hit the street in 1956, I was 5 years old when it actually came out. Interesting. Okay, one of the reasons why we want you to use AMBU bags and different size AMBU bags is because our tidal volume, which is our lung, pretty much an average lung volume for each person, is different. It's different for the adult and for the child and for the infant and for the neonate. Okay, so people will say, well, use the adult bag but just don't squeeze it as much. Well, that's not going to happen. You know, we use these bags, we use a lot of the stuff we do in CPR by muscle memory. We create a muscle memory when we're practicing on the mannequin, and then we do those exact same things real world when we're actually with a patient. So you're not going to squeeze the adult bag just a little, you're going to squeeze the entire bag. Now that will not hurt an adult. You're not going to overinflate an adult with an AMBU bag. The adult is what it is. Child, probably unlikely that you'll do damage, although you could, depending on the size of the child. However, for the infant, that's way too much air, and yes, you'll do structural damage to the little one. And you damage the alveoli, the air sacs, and then the oxygen molecule will no longer go through that membrane, which means it doesn't go into the oxygen, into the blood supply. So now no oxygen is being circulated, no oxygen, not good for you. Okay, so that's the concept. Now, as far as tidal volumes go, the average adult, again, these are ballpark numbers, but roughly 7 milliliters per kilogram of body mass. So that's pretty much the size of the adult BVM. For the child, roughly 5 milliliters per kilogram. The infant is roughly 4 milliliters per kilogram, and the neonate is 0.3 milliliters per kilogram. So that's pretty tiny. So that's again why we want you to purchase all three, so that in fact you've got the right size for the right person. There are some advantages to this. You know, air around us, for the most part, contains 21% oxygen. We exhale 16% oxygen. So the average person only uses 4 to 5% of what we breathe in. So we're blowing plenty of good air, because that's some of the things you'll hear in your class. Well, you know, if you're doing mouth to mouth, you're blowing bad air into the patient. Not really. You're blowing roughly 16% oxygen into that patient, which means 3 to 4 times what they need to stay alive. Bottom line, works extremely well. Okay, now what's the advantage of the bag valve mask? Well, one, you don't have to lock lips, so you're protecting yourself from the patient, and you're now delivering 21% oxygen to the patient, because literally room air is going right through the bag valve mask and right to the patient. So with the adult mask, adult BVM, I've connected the reservoir to it, so you can take a look here. This is called a reservoir. And you hook your oxygen supplement, your O2 bottle, up right here. What that does is fill the reservoir with oxygen. So then when you're actually squeezing the bag valve mask and the bag mask sucks from the reservoir, you can actually increase your oxygen to 100% that you're ventilating the patient with. Okay, that's pretty good. So again, room air 21%. If you supplement it with oxygen, you can go as high as 100% oxygen. Now when you look at the bags, you can see the difference in size. Here's the adult, Here's the child. And here's the infant. So you can see quite a bit of difference in size, and that's why our instructors at our training center faculty that ask you sometimes, they'll ask you to hold it up, because sometimes the child bag valve mask is a little bit larger in size, but it's still smaller than the adult. So that you'll see, some will say child/adult. We prefer you have 100% child, but it still would be considered okay. Now, in using the bag valve mask, you know, a lot of times we have people that put it on upside down. Remember, the pointy side goes to the top of the nose. And you should always be, literally, over top your patient to deliver this. Now, sometimes, in order to get the techniques proper, what we'll have the student do is place the mask on a desk, on a tabletop, get their fingers, the EC here, and try to squeeze. And they should realize that they got a good flat seal. And then transfer that to your patient, pointy side to nose, 2 fingers, EC. Okay, there's your C around the top, 3 fingers under the jaw, bringing the head back all the way, and a gentle squeeze of the bag. Okay? And ventilating the patient. Nice slow breath, not a real rapid pull. Nice slow breath with the bag valve mask. Okay, so you can have the reservoir hooked up to it if you have that. If not, you can take the reservoir off and just train with the bag valve mask. Okay? But again, simple to use, easy to use. So I'm not sure why sometimes we have such a hard time with our students and with our instructors utilizing the bag valve mask. Okay? If it's attached to an ET tube, I still recommend hanging on to the ET tube, because sometimes your bite blocks. Literally, saliva makes a good slick surface. So sometimes you'll see people using 2 hands to squeeze the bag hooked to the ET tube. I still hang onto the ET tube when I'm squeezing, still squeeze with 1 hand. 2-person technique. There is a 2-person technique. And again, what happens here is another person is actually squeezing the bag. And what you'll be doing, let me disconnect my bag, is literally they take 2 hands to secure the mask on the patient, head back, and this is what they hold. Okay? The other person is hooked up to this, and the other person is actually squeezing the bag. Okay, so a 2-person technique is used with a bag valve mask and works very well. The problem with that is that a lot of times you don't have the manpower to have 2 people working on just the bag valve mask. You got too many other things to be taken care of during a cardiac arrest that you typically do not have an extra person just to do that. Okay, always remember at the head of the patient. Up here, we see some people doing it from the side, and yes, there are times, especially sometimes in the back of a unit, back of an ambulance, where we are on the side of the patient ventilating, because that's the only room we have to be able to do that. However, the technique is always at the head of the patient. The reason you're up here is because when you have to intubate the patient, getting the head back, you're typically always at the head of the patient doing that. You never try to intubate a patient from the side of the patient. Okay? So that's the logic behind that. Okay, we try to keep these things relatively close, easy to do, up to date, current. Other news is we were going through our Stop the Bleed kits, and let me show you what our Stop the Bleed kits look like. This is a Stop the Bleed kit. Okay, has all the stuff required for the Stop the Bleed program. Now, with this said, we were going through here and we realized that, you know, all your material, especially sterile stuff, has a expiration date on it. And we realized that a lot of the stuff coming up this June will be starting to expire. So we got in touch with our distributors and got new stuff coming in to redo our Stop the Bleed kits. And also realize that there's a good possibility that if you have Stop the Bleed kits wherever you're at, some of the Baltimore County schools have Stop the Bleed kits in all their locations, the stuff is beginning to expire. So check and see what you need. As we have stuff coming in, we'll be able to get more current stuff out to you so you can keep your kit up to speed with expiration dates. Okay, that's pretty much everything. So I want to thank you for watching. There is no secret word this time. This is just information for you to do a better class. And we look forward to seeing your monitors. And for those of us that do have to do the monitors, it means a lot to us that you are watching. We've got a fair number of people subscribed, but remember that subscribe lets us know that you are watching. It also lets the YouTube channel know that we have people watching. So again, it doesn't have to be an instructor. If you have family and friends that want to see what we're doing or even what you're doing as far as teaching the class, have them watch our podcast. We welcome everybody to watch. And again, if you have any ideas, suggestions, questions, get to us so we can put them in the next podcast as we try to get through to everybody how to do this. Okay, so again, thank you for watching, and I'll see you next month.